Tonight we are meeting with our 2010 graduate, Dr. McEvenew, who was part of a team of surgeons who performed the first successful hand transplant operation in Canada. So take us way back to maybe little Giancarlo. Where did you grow up? Where did you end up going to college? And how did you come to attend SABA?
So I grew up in Toronto. I mean, I always wanted to be a doctor. I'm sure some of you guys have similar stories to that. I don't know where it came from. I was just like, I think that's what I want to do. Oh, I wanted to be an NHL player, but that didn't work out. And I was like, okay, I'm going to be the NHL team doctor. Yes, the Leafs doctor. It sounds like a good idea. I think it's important, like, university's tough. And I think if especially I went to University of Toronto undergrad, and it was horrible. The first year was horrible. I'm sure people can relate. The grades are like terrible. My grades were terrible. I'll never show that in a presentation. And I was just like, a bit struggling. And then somehow I just found my way. I think maturity plays a big part in it. And then I was getting really good grades. I just never gave up on the dream. And I forget the question a bit, but I think that's a good answer to whatever it was.
The last part of it was, how did you come to attend SABA in particular?
I really wanted to go to U of T. That was like, I was brainwashed from day one of U of T. Like, I see these guys with their fancy matching backpacks. But I kind of realized, like, that's not my dream. My dream isn't going to University of Toronto and saying I was at University of Toronto Medical School. My dream is becoming a doctor. And then when I spoke to a few graduates and the residency match list, which I thought was kind of like, I didn't really understand it, that's the most important thing. Like, if you look at the residency match list, not only where they're graduating, but how many of them are.
Now tell us, you got on the plane and you made it to SABA. What were those first 5 semesters like? And then where did you do your clinical training?
For me, I was like a fast adjustment. Like, the weather was beautiful. You dive right into your studies. Like I said, I was like diving into a cadaver pretty much, like operating, because your first course was anatomy, which was like, this was what I've been waiting for. Like, I've been doing all this BS, I don't know if I can say that, for 2 years. And then now I'm doing what I want to do. So it was like, for me, it was a really easy adjustment. I made some really good friends. So SABA life was awesome. It is a quiet island. It's like a more of a dive eco touring island. So you're not like, you don't have casinos or like crazy stuff going on. And for a guy who can get distracted, I think that was like a blessing in disguise. And I studied a lot. And then clinicals, the school really helped you set up the clinicals. And I liked moving around, and I wanted to go to university-affiliated hospitals, so I did extra work. Like, I went to Mayo Clinic for plastic surgery. Like, that was awesome. Like, I got a reference letter. I got to do surgery in the U.S. I got to do surgery in different American cities. I got to do surgery here in Canada. I did some electives here.
Okay, it sounds like from day one you wanted to be a surgeon,
Yeah.
but what was it that led you to plastic and reconstructive surgery? Was there something in your clinical rotations, or how did you get to that particular field in surgery?
Yeah, so I was definitely like gung-ho surgery, and I actually never thought it would be possible, plastic surgery, because again, I was like, I'm coming from the Caribbean, this is gonna be impossible. I should just be thankful for getting surgery. And surgery is hard enough to get into. It's extremely competitive. They want the best and the brightest. And so I'm like, yeah, I want surgery. So I did my elective here in Toronto, and I was able to set up 2 electives in surgery. And now I think they have a lottery system, because there's so many people that want to come to Toronto. It's a very difficult thing to actually get the elective in what you want. You have to be very flexible in terms of the timing, apply early, and maybe be flexible. And so for me, they're like, the general surgery is full. And I was like, what do you mean? No. But they were like, general surgery's booked up, but you can do ortho and you can do plastics. And I was like, great. Like, what a waste. Like, grumbling. But then I was like, you know what? I'm going to do them both, and I'll get a letter, and they're from surgeons, and then I can get into general surgery, and this is going to work out fine. So I did ortho, and I hated it. I was like, these guys are savages. They have hammers and drills. This isn't surgery. Surgery's delicate and gentle. And so I was like, I hate this. This has been a waste. I'm an emotional guy. I get all worked up, And then, so then I did plastics, and right from the beginning, I was like, this is incredible, and but I'm never going to get it. So, just do your best. And then one night, we had this lady who had attempted suicide, and she'd almost cut off her whole hand. And, I was a medical student. Again, right place, right time, because the resident was off on a maternal leave. So I was like the de facto resident. So I got to like assess the patient, admit the patient, book the patient for surgery. they're like, who is this guy? This guy's like the man. He's the man medical student. And we go under the microscope, similar to what I showed you, and we're reattaching, kind of like the transplant, but it's a replant because it's our own hand, and we're reattaching it, and we're under the microscope, and it's like the whole night surgery, and I'm like in there, and I'm doing everything, and I'm like, this is having the time of my life, actually. I was like, I found what I want to do. Like, this is incredible. And at the end of the case, my boss is like, that was awesome. Like, are you sure you never done microsurgery before? And I'm like, you know what? It's kind of like PlayStation 3. And I'm going to tell my mom that all those years of video games definitely paid off. Because this was that's what it was. And he laughed, and he's like, well, you're really good. And he goes, you should do this.
Right. So could you just tell us maybe some of the biggest things that you took from your education at SABA that got you to where you are today?
One of the biggest things I took was like the friendships. So I met like amazing people, and I don't think that's maybe particular to SABA, but the people at SABA are not like different from any other medical student. They're just people like me, and so I think that network and support has really helped me through my residency. The other thing would be like the work ethic. So I mean, right from day one, you got to work really hard, and I was ready. I was like, I wanted the challenge, and so they set me up, and then I just took that with me all through residency, and then I had these great friendships that I could call and vent to about a rough day, or celebrate these great accomplishments together with.